Welcome to Reddit Alien. Serious. Psychologists of Reddit. What is the most interesting mental disorder you've come across? Not safe for work. Please remember to like, share, and subscribe. I once worked with a guy whose voices were positive, like a cheer squad. So instead of, "You're useless, no one likes you," his voices said, "You look amazing today. People think you're charming and funny." It wasn't great though. He has enough insight to understand that they were as much a hallucination as if they were giving negative messages, and he felt this crushing, overwhelming pressure that he couldn't live up to the incredibly high standards of his voices. It was quite crippling for him, really, as much as, if not more so, than if the voices were negative or even benign. A psychologist here. Not someone I worked with, but I did observe someone with alien hand syndrome. The patient's left hand would stroke her hair and pat her face, but was not under her control. Each episode would last for about 20 minutes. Turned out the cause was a tumor. Amazingly, it didn't seem to cause her any distress. Hemo Neglect is a pretty interesting one. The affected person just doesn't realize that they have two halves to their body and only takes care of one. Shave one side of their face, brush their hair on that side, wash themselves on that side, but the other side basically becomes dirty mountain man. Medical doctor here, neurologist. Capgrass Delusion. The patient is convinced that a family member has been replaced by an imposter who is completely identical. For example, the patient will tell you the person sitting across from them looks exactly like their spouse, sounds exactly like their spouse, has all the memories of their spouse, but that's not actually my spouse. And the patient oftentimes isn't overly distressed by this imposter. In 20 years, I've only seen the condition twice. Phantom pregnancies are pretty fascinating. A woman can be so convinced that she is pregnant that her period stops. She gets all the classic symptoms, and her belly might even grow. Nobody is totally sure how this happens. Also, sheer psychosis is pretty crazy. There was a case a few years ago where twin sisters visited each other. One was mentally ill, the other not. And the ill one went into a psychotic state, and then the healthy twin, suddenly for no reason, went into the same psychotic state. They threw themselves into traffic multiple times, getting hit by trucks. After being separated at the hospital, the healthy twin snapped out of her psychosis and was fine. The other one stayed in her psychosis and ended up killing someone with a hammer, and neither of them remembered anything that happened. I find that sheer psychosis diagnosis completely fascinating. I wonder if it could possibly be because of the connection that twins share, or could that happen to two other siblings, or two people who are roommates? Pretty wild. Mental health counselor here. The interesting one is schizophrenia with visual hallucinations. Most people with schizophrenia have auditory hallucinations. I did not realize how much more unsettling the visual one is. The client I had with the disorder used to see me and other people he knew. He called me up yelling at me for coming into his apartment early in the morning. Even if I told him otherwise, the experience of seeing me is very real to him. I can't imagine seeing people in my own home, especially at night. That would freak me the F out. Social worker here. Used to work at a psych hospital. Saw a form of OCD where the patient could not let go of anything she came across or made. Leaves, sticks, tampons, pads, poop. Some stored Tupperware, some most hidden where her feet went in her bed. We would routinely have to go through her room and get everything removed. I don't remember how she did in treatment, but I remember that she was a teenager and felt terrible that that's what she was dealing with. Medical doctor working in an inpatient psychiatric facility. We had a psychotic patient with visual hallucinations who saw colored dots all around him during episodes of distress. The great thing about it was he told us he was able to blow the colored dots away. We encouraged him to do it, as it seemed to greatly reduce anxiety. Early on in my career, I worked at a planned community that functioned as a partial hospitalization program. One of the residents would bring magazines and newspapers he'd found to the main office door every day. Sometimes he'd be upset, sometimes overjoyed, depending on the stories, because all of them were about him. I've never worked with someone with such delusions before or since. One day he was Michael Jordan offering to buy us cars. The next he was Osama bin Laden trying to hide with us. He'd read his obituary. His wife cheated on him in a political scandal. He'd surveyed the Congo. We restricted and sorted his mail after the bin Laden incident, but he'd find other residents or in the community. Never saw a patient with it, but I'm a nurse, and in the electronic medical record we use walking corpse syndrome is always at the top of the diagnosis choice list. Apparently it's when you're convinced that you're dead. Never understood why it was at the top of the list. Psychiatrist here who's worked in high secure settings. I've dealt with serial killers, cannibals, rapists, etc., but one of the cases that stands out to me the most is an OCD case from training. So, for those unaware, OCD has various forms. This man suffering from sexualized OCD, where the thoughts were of a sexual nature. The two most common forms are incest and pedophilia. Now, to be clear, these people have no desire to sex their relatives or children, but are plagued by constant distressing thoughts of doing so, closer to memories than thoughts. So this man had pedophilic OCD and had been admitted after his daughter called the police. He had been holed up in his room for months, refusing to come out, refusing to talk to people, and utterly disgusted at himself. When the police came to take him, he assumed they knew about the pedophilia and went with them. His daughter, an adult herself, asked to give him a hug as he left. He refused, citing that he couldn't bear to touch her. When I admitted the review was one of the oddest I've had. IT was essentially an hour-and-a-half review where he said nothing. The thought of what he had done were so abhorrent to him that he couldn't fundamentally bring himself to talk about them. But he desperately wanted to. So anytime I tried to end the session, he grappled with coming up with a reason for me to stay, desperate to tell me about these thoughts but unable to verbalize them, as that would make them real. Instead, he continued to talk around the topic, leaving out important words like children and sex, or sitting in silence until I tried to leave and begging me to stay. It transpired he had been racking his mind to try and place these images of abusing children with times in his life, believing he had blacked out and committed atrocious acts on his daughter's friends, and now these were memories resurfacing. This case taught me a lot about treating psych patients, but one of the oddest points was that he was one of 3 male patients all admitted with the same thing at the time. This is far more common than people realize. IT is also part of the reason I frequently point out to people that the whole hang the pedo stance is actually counterproductive and leads far more harm than saving kids. I worked as a crisis worker as a behavioral health case manager for a year. There was a client there with intermittent explosive disorder, probably the most interesting client I've ever met. Would, as the diagnosis would suggest, explode during an escalation. It was too much for us to handle, and the client ended up getting taken to the hospital. I'm a therapist. Pika is an interesting one I've seen that hasn't been mentioned so far. The person needed constant supervision, or they'd be eating cigarette butts and whatever else caught their eye. Pebbles, litter, things like that. I'm a psychology student, so I haven't seen any patients yet, but one of the most interesting mental disorders I've studied is prosopagnosia. It's the inability to recognize faces. But the thing that fascinates me the most is the fact that someone with prosopagnosia will be able to recognize others by distinct characteristics, like a mustache or a voice, and won't be able to recognize them if they shave or don't talk. I don't technically qualify, as I'm not a psychologist or doctor, but I was a support worker, and one case I had was a boy with pandas syndrome. It basically manifests as severe OCD. It can completely alter the personality in the child. This kid wouldn't leave his room, to the point he would just urinate on the carpet. He would scream obscenities to his parents for no reason. This is actually caused by having strep throat, except the bacterial infection doesn't go away, and it can turn into pandas, and the treatment is most often just a very specific antibiotic. But the children often need therapy to deal with the aftermath. Their personality goes back to normal, but it's very upsetting to go through. Doctor training to be a psychiatrist here. Had a patient who recently was convinced he had fathered a child. He hadn't. He got in trouble because he would go to this kid's school to try to contact him. Parents were understandably upset and had never had any contact with the patient previously. Patient believed that Stephen Hawking had inseminated the mother with the patient's sperm by some sort of telepathic process, but he couldn't explain. Truly bizarre, and so far hasn't really gained insight with treatment. He gets very emotional thinking about his son. Still works full-time though, and in many respects leads a normal life. Amazing. Now that is truly wild, and probably extremely frightening to the parents of that child. I don't think there's a winner in that scenario, but kind of sad in a way. Psychiatrist here. One of my most interesting cases was Cotard's syndrome. I was an intern and ended up seeing the patient on the inpatient unit, and later in the state hospital. He had the delusion that he was dead. You'd ask him how he was doing and he would shout, "I'm burning in hell." My other favorite is a patient who has the delusion of pregnancy and thinks she's pregnant with over 50 babies at the same time. I'm a licensed psychologist now, but before I went to graduate school, I worked in an inpatient mental health hospital on an adult and adolescent units. I would say the most interesting two disorders I've seen are dissociative fugue and conversion disorder. I saw both while I was there. Dissociative fugue is a condition where someone can wake up one day and believe they are a different person for a short time. My experience was a man who woke up and drove his car from his home until it ran out of gas, which happened to be in my city. He had no identification with him and didn't remember his name, family, or any details of his life. After a short stay in the hospital and some medication, he remembered everything and had a family member pick him up and monitor him for a while, but he still had to put gas in the car, which had been towed to the hospital parking lot. Conversion disorder is characterized by the individual losing the ability to do something, e.g. walking, seeing, talking, and believing that has a biological component. In reality, it's a response to significant trauma and is disassociative in nature. A woman in the hospital manifested the symptom of losing her ability to walk while she was in the hospital. There was no reason as to why she wasn't able to walk. She came in walking, was unable to ambulate while there, and left walking again. I think the big thing I take away from these stories is just how powerful the brain can be, affecting the physical as well as the emotional part of our lives every day. Thanks for sharing, everyone. Mental health counselor here. The most interesting disorder I've ever treated was dissociative amnesia. This guy had big edits out of his life that had him ending up in trouble with his girlfriend, and when I was seeing him was on the border of getting him in trouble with the law. Medical doctor here. Not a psychiatrist or psychologist, but I did encounter a pretty interesting patient case on my psychiatry rotation when I was in medical school. There was a patient at an inpatient psychiatric facility for suicidal ideation. During her admission, she constantly insisted that she had a mass on her breasts and demanded to be physically examined only by male doctors. When the psychiatrist I was rotating under declined to perform a physical exam, she asked me to do it during my daily patient interview. I also declined physical exam, but had a bit of a hunch to check her medical records. It turned out she had an ultrasound done a week before that found only normal breast tissue without masses. However, apparently, this lady had frequented many doctors' offices with various complaints of an unspecific nature and would usually focus on breasts or vaginal complaints when she visited male physicians' offices. The psychiatrist I was working with diagnosed her with factitious disorder, formerly known as Munchausen syndrome, and also felt she had a personality disorder. He felt it was histrionic personality disorder, but also felt it was possibly borderline personality disorder, definitely cluster B though. It seems her goal was mostly attention from medical professionals. She had lots of issues, but we also had to be careful to make sure she wasn't fishing for a lawsuit. Patients like her are why doctors document everything meticulously, so the patient wouldn't admit to making things up all the time. According to the psychiatrist I was working with, she didn't actually believe any of her health problems exist, and her primary goal was the attention from medical professionals. If she actually believed she was sick, we would have diagnosed her with illness anxiety disorder, commonly known as hypochondria. I work in mental health, and the weirdest one I came across was someone with factitious disorder, previously known as Munchausen. Client was in the ICU for medical issues that the doctor could not figure out. This was like visit number 5 for the month, and they called mobile crisis to evaluate the client. It took hours of talking to the client, family, the doctor, the nurses, to figure out the client was making themselves sick, and we ended up committing them to inpatient treatment. Never had that happen again. It's pretty rare. Selective mutism intrigued me. They have anxiety to the point they don't speak. Happened to my mother's granddaughter. After my mom died, she drew a painting of my mom, her grandmother, saying how nice she was to her. I wish she was able to say that to her in person. However, the condition is, as I understand, related to an anxiety disorder. Pain conversion disorder. I had an ex-girlfriend that was in a wheelchair, but her parents and doctor said she could walk, but her legs won't let her. Her parents said she may have woken up during a surgery she had when she was a kid because it all started after that surgery. She even went to physical therapy for it for years. She might still do that, I don't know. But she could move around without the chair, kind of, but she couldn't walk. So it was almost a disability, but not fully. Very confusing. She was supermodel hot though, and the coolest girl I ever dated.